attacking itself. And with that, you're going to have warm joints because there's like inflammation in the joints, there's like an infection in that. Osteoarthritis is non-inflammatory. It is basically the use and abuse disease. It is from, they call it wear and tear. So if you've broken a bone or injured a joint really bad, your doctor may say you're going to have arthritis later in life. That's what they're talking about. You're going to get osteoarthritis. You need to know the differences between the two. So remember, one is autoimmune and it comes with inflammation, and one is non-inflammatory. They don't really know what causes it, but they know people are more likely to have it when they're older, when they're obese, when they've done a lot of physical activity that creates mechanical stress. So people that have overused joints throughout their life, like marathon runners, that's really good for your body, but later in life, a lot of them end up having osteoarthritis. People that do the same repetitive motion throughout their life, or people who have injured bones or joints have this. So it can be related to trauma, maybe sepsis, or some type of connective tissue disorder. With this, they have limited mobility. They have pain and crepitus with joint movement. This slide's important to know. They have Heberden's nodes, which are bony swellings that can develop at the distal interphalangeal joints. And then they have the Bouchard nodes, which are bony nodes that occur at the proximal interphalangeal nodes. You don't really need to know where they are, but just that this is what they can have. But a lot of people with osteoarthritis will have these. So see how the fingers look. Some of the patients that you'll be dealing with at the nursing home, look at their hands and their feet. They will have osteoarthritis. And you can see what's happening to that bone structure. So it's not just swelling, it's actually like the bone, these nodes are growing there. So we do x-rays, bone scans, CTs, that kind of stuff. They will do maybe a blood test or two to try to rule out autoimmune, because if they see autoimmune, then they know it's rheumatoid and not osteo. They treat it with pain medication, anti-inflammatory medications, but a lot of these they have to take forever, and a lot of them are hard in their stomach, and then they'll come back with a GI bleed because they're bleeding to death. So a lot of it is resting and mild exercise. So we want to do range of motion and strengthening exercises, but be very easy on them. Sometimes they use heat and cold for that. One of the main things that they'll tell you to do is lose weight. So if you have this osteoarthritis, one of the main things is to reduce your weight so you decrease the stress on your joints. Then there's other different things, music therapy, acupuncture. They may be good or not, I'm not sure. Then they also may have you wear splints or other orthopedic devices to help protect the joints. All right, getting closer here. Different traumatic injuries, strains, sprains, contusions, these are things that we are going to talk about here. Musculoskeletal trauma is the 5th leading cause of death, and fractures account for more than half of that. A contusion is a bruising, and bruises from now on for the rest of your life as a nurse, you can no longer call it a bruise. Does anyone know the term for bruising? I hear mumbles. Hematoma is like a collection of blood under it, and it will show as bruising. But the main term I want you to know, and this will be on the test, and you'll see it forever, is ecchymosis. You ever heard of ecchymosis?
No, spell it.
It's ECCHYMOSIS. Ecchymosis is what you would include in your charting, and if you're looking when you're doing a documentation and you're like, there's not bruising that I could click, but there's ecchymosis. Ecchymosis is bruising, and that's what you have to know, that term forever. There's no more bruising, never chart bruising. It's always going to be ecchymosis. This is the black and blue area that has pain, swelling, discoloration.
So I guess I don't understand how it's any different than a confusion.
So, well, it goes along with it.
Okay.
A contusion, but a contusion is just a term that we use, but generally, you'll say ecchymosis to that, so when you're charting on that. So you can like go home, and if you see that on your partner, you could be like, you got some ecchymosis right there, you know. They'd be like, wow, you learned something at school, you're like a real nurse or something. So, but just, that's the terminology that you have to use forever and ever. A strain is an injury to a muscle or tendon from overuse, overstretching, or excessive stress. And a sprain is an injury to a ligament and tendons that surrounds a joint. These are caused by twisting motions or hyperextensions of a joint. They are graded in first, second, and third degree, and sometimes a sprain or strain can be worse and take longer to heal than if you just would have broke that area. So those are traumas. So you need to know the acronym RICE. This is for musculoskeletal trauma. And RICE is rest. This prevents additional injury, promotes healing. The I is for ice. You went to ice for the first 48 to 72 hours. This causes vasoconstriction. So vasoconstriction, we're going to decrease the size of those blood vessels coming to the injury. So if you don't give as much blood to that area, then you're not going to have all the swelling. So when you decrease the swelling, you're going to decrease the pain, and you're going to decrease bleeding to the area. C is for compression. So a lot of times that you will use an elastic bandage. It helps control the bleeding. It reduces edema and provides support for the injury. E is for elevation. Remember how we're going to elevate above the heart? This is going to help control swelling, which also will help with pain control. You also need to monitor their neurovascular status. After the first 72 hours, they may use a little bit of heat. This will cause vasodilation, and it will allow your body to absorb and repair the injured area. And like I said, strains and sprains take weeks, or if not months, to heal. Dislocation. Dislocation is like if you have a joint and the bones are no longer in anatomic alignment. This is considered an orthopedic emergency because the blood supplies to this area and the nerves are displaced. It causes possible pressure on them. If you don't reduce it immediately, which reducing is putting it back, you can have necrosis that starts to occur. Because if you have a joint and the joint's supposed to be aligned, and then all of a sudden your joint's like this, think of those blood vessels. They're stretched and they're kinked like a straw. If you take a straw and you kink it, say that's your blood vessel, you're not getting that blood. And tissue without the blood supply and without the oxygen is going to start breaking down. It's going to get necrosis. It's getting necrotic. And if that's your arm, that's going to be bad. And that this necrosis is permanent. It's not like you can get the blood supply back. What will happen is you start losing the oxygen in those tissues. They start degrading, and plus the blood that's left will probably clot. It's a bad thing. So you usually know there's severe sudden pain, there's a shortening of the extremity, deformity. They may do an x-ray to show what it is. They'll immobilize it at the scene, or they'll reduce it. So generally they will reduce it. You need someone that knows what they're doing. So like go to a doctor, not your friend, and be like, I need this fixed. And I've actually helped a doctor do it, and it's kind of crazy because they really are pushing really hard, but they'll usually have us give them some pain medicine. And this doctor's like, okay, I'm gonna go on 3, and then he goes on 1 or 2, because you don't want to because as soon as you think, okay, and you tighten up, but then they put this enormous pressure going, they know which way to go, and they pop that joint back in. And with them, it's usually immediate relief, and then we'll do an x-ray to make sure it's in proper placement. People that end up having these will have them multiple times. So they'll have it, and then they'll have it again. Or it could just be from trauma, and you had it one time. I don't think anyone ever wants one of these, but it is a medical emergency. You need to get them to someone that can fix them right away, and get it fixed. A fracture is a break. It can be complete or incomplete. It can be by a direct blow. It usually is associated with soft tissue injury, but it can cause hemorrhaging and damaged blood vessels, and your body can be damaged. Like, say you're in a car accident and your rib breaks. Well, the rib is designed to protect your internal organs, but sometimes the rib turns into a projectile, and then a lot of people who die of internal injuries are dying from their own bones rupturing, their spleen, a rib going into the heart, a rib putting down your lungs. So you are a lot more fragile than people believe. So we damage these bones with our patients when we're working with them. They can fall. We break a lot of ribs when we do CPR. It's unfortunate. And as soon as you do it, it's like, I've done it multiple times and I felt it break, and then I just want to do that, I'm done, but no, you can't, so you have to keep going. And on a couple cases that we did a hemothorax, which the rib broke, went into the lung, caused it to bleed, fill up with blood. And I remember doing CPR on a guy, and just so much blood's coming out of his mouth, and I'm like, okay, we really killed him now. That was my thought. I'm like, we really killed him, and we did. But if we didn't do CPR, he was going to definitely be dead. You know what I mean? So, and this was a really older person that had real weak bones. So it doesn't happen all the time. Generally, your ribs are flexible and they go. So, when you have a fracture, there's complete, which is just it's going right across. There's an incomplete, which is maybe part of it. There is commuted, which is fragments. Closed, which is no break in skin, and open, which is a compound break in the skin. So you don't really need to know a whole lot about those. I would know about the open and closed. On an open, when the bone is sticking out of their arm or leg, they're at risk for osteomyelitis. It's a lot of pain. So our number one thing would be pain control, is if they have a compound break or an open break. And we're running out of time. I'll tell you this story here, and then we'll go. When I was on the fire department, and we had this super large person that needed to come into the hospital, and they called for the medics called for the fire department to help with transport. This lady has not been out of bed for some time, but she said she could walk, and they wanted her to walk because they couldn't get the carpet through the bedroom. Anyway, she was 500 to 600 pounds. And the first step she took bare weight, she had her leg went out through her ankle into the floor. And then I still remember this day because she put her leg up and was screaming. There were Cheetos stuck to the end of that because she had spilled Cheetos on the floor. And I was like, I can't eat Cheetos today because I remember the Cheetos. And then I remember the guy next to me started throwing up, and I was like, this is getting bad. But anyways, we were able to get her on the car, and then she went to the hospital, and I believe she's okay, but it was just, Cheetos should not be on your exposed bone. So we all then, she sat back down, but then we were able to, I guess with all her adrenaline, with her screaming and we're seeing that, we were able just to someone, we had like a posy type of a belt around her, and we just were able to get her into the hallway onto that, but.
Have you seen I Now Pronounce You Chuck and Larry?
No.
With Adam Sandler.
Is that-
You need to watch the very first scene.
Is it similar to that?
Because that's literally similar to that.
Yeah, well, it was
What's it
something.
called? What's on
I'll
it?
tell you that. So, no open and compound breaks. They're extremely painful, so pain control is gonna be our number one on that. And maybe we'll go a few more, then we'll just be done with this. Okay, so, medical management is we're going to reduce it. It can be open or closed. So an open reduction, like we talked about before, is surgery. Closed, they're just bringing it to alignment, and then they're going to use like something to mobilize it with, a cast or splint or some type of external fixation. We want to maintain and restore function. So we want to make sure that if they had an internal injury, that they've not gone into shock. So hypovolemic shock from hemorrhaging related to trauma is a possibility. So if this happens, they may have torn an artery or put a hole in the artery. They're bleeding internally. Their blood pressure is going to tank. Their heart rate is going to go up, but it's going to be really thready. Sometimes people will get a fat emboli. Fat emboli is from fracturing of a long bone. This is usually young people. So people in their 20s are more prone to a fat emboli. So if you break a long bone, then about 24 to 72 hours after the injury, so not immediately, but after the injury, these people will start getting petechiae, which is those little blood clots on their skin, and they get severe respiratory distress. A lot of them will have to be intubated. So a fat emboli is someone who's young, who damages a long bone, and it's 1 to 3 days after the injury, they will develop severe